Los Angeles County's child welfare system is the largest in the nation. The Department of Children and Family Services currently supports nearly 21,000 children. Although the agency has faced intense scrutiny in recent years over systemic failures leading to tragic child deaths, department leaders say the agency is making necessary reforms to ensure a safe environment for children while striving to keep families intact. Welcome to One-on-One, where we explore the issues of our time with the county leaders driving solutions. In this episode, we sit down with Brandon Nichols, director of the Los Angeles County Department of Children and Family Services, to learn more about how DCFS is stepping up to meet the needs of children and families. Here with us today is Brandon Nichols, who was appointed director of the Los Angeles County Department of Children and Family Services in 2022. Thank you so much for joining us.
Thank you.
The department oversees thousands of children, and it's very broad and complex, right? But in essence, what is the mission of DCFS?
Our number one mission is making sure that children are safe. And when children can't be safe in the home of their parents, taking care of them and working with the parents to try to get them home as quickly as we can.
And there is always a critical balancing act between wanting to keep these children with their families, but also preventing abuse. So how does the department determine these life and death decisions?
I think this is some of the hardest work in the county, to be honest. It is human, it is emotional, it's personal. We're out in people's homes asking them very sensitive questions. Really, we depend on the men and women who work for the Department of Children and Family Services, our social workers. We try to provide them tools, training, teaming to support their decision making, but they're the ones that have to go in, assess the risks posed to a children, and decide if those risks are too much, requiring us to remove a child from their parents. Nobody here wants to separate a child from their parents. We only do it when absolutely necessary.
There is a 24/7 LA County Child Protection Hotline that anyone could use if they suspect that a child is being neglected or abused. In 2023, there were over 188,000 calls to that hotline alleging child abuse. So when should someone use that number?
Anytime anyone out there thinks that a child is unsafe, I would ask them to call the hotline. We have trained professionals 24 hours a day, 7 days a week that'll take the information in and then if necessary send a social worker out to investigate further. We want to make sure that children are safe and the hotline is the best way for people with concerns to do that.
And I know that the department is really focused on training mandated reporters so they can be better able to differentiate between poverty, neglect, and abuse. So talk to us about who are these mandated reporters and what does that training look like?
Mostly we're talking about teachers, medical professionals like doctors and nurses, and members of law enforcement, police and the sheriff. When they see a child that they have concerns about, they are required to call the child abuse hotline. We're not turning away calls. We're taking in everyone that comes in.
What do you recommend for a family that is struggling, does need help, but does not want their child to be taken away?
Don't suffer in silence. Reach out and get the help that you need. The best way to do that is by dialing 211. There are experts there that can guide families to a number of low-cost and no-cost services to address whatever it is they may be struggling with.
In recent years, the department has faced media scrutiny for its handling of heart-wrenching cases of child deaths that raised concerns over systemic failures within the department. So what is DCFS doing in order to prevent these tragedies moving forward?
We have made some changes. We've increased our workforce, so our caseloads are much lower. We've strengthened our teaming with other partners. We now work with medical hubs, which provides us medical expertise and access to input from doctors and nurses and advice from disciplines other than just social work. And we have seen the number of critical incidents and children dying come down over the years as a result. It is a complex system. We are a county of 2 million children. We have more work to do, but I'm happy in the progress we've been making.
One of the ways DCFS trains new social workers is through DCFS University's simulation labs. Do all your social workers go through here?
All new social workers coming into the department go through the university. This is one of our sim labs. You know, out in the real world, social workers go and knock on a door.
Right.
They don't always know what's on the other side of that door. They don't know what the parents are going to be like or how they're going to react to a social worker knocking on the door. They don't know what they're going to see in a home. So before a social worker goes out and does that in the real world, we give them an opportunity to practice here at the university. We've set up mock apartments and we run mock scenarios. So social workers can experience that first knock, that first encounter in a safe learning environment rather than out in the field. And then we have an area over here where other social workers who are going through the academy get to watch the experience. I hope the community appreciates and values the work they do. I hope they understand how much they love kids, how much they really want to take care of families, how they really want to heal sickness and put people on better paths, give them hope.
Talk to us about who can adopt. There's a lot of myths out there.
Anybody with a big heart can adopt. Any race, any creed, any economic level, any sexual preference, any gender. If you've got a love of children, we will work with you to get your home ready to help take care of a child.
You can either become a resource parent or an adoptive parent. And both do get a stipend, correct?
So if you're caring for a child for a short period, we give you a monthly amount to help pay for the care of that child. But if you choose to adopt a child and make a new family with them, those payments will continue to help support the child into adulthood.
What are the requirements as far as like home visits and getting approved and all of that process?
We have to do a background check. We have to inspect the home to make sure the home is safe. And then we do some training so that parents understand our system, they understand the commitment they're making, and they know where to go to ask questions if they have them.
Let's talk about racial disparities. So we understand that as of July 2024, over 60% of children in foster care are Latino, and Black children are more likely to experience negative outcomes while in care than other children of other races. So what is DCFS doing to address these racial disparities?
Firstly, language in the county is diverse. We have to have social workers who are able to speak and interact with families in their native languages. Beyond that, we know that the county has had a racist past, and our system has operated in a racist way, specifically when it comes to the Black and African American community. There is overrepresentation of Black children and families in our system. We're taking it very seriously, and we have specific programs now targeted to help reduce some of that disproportionality. Things like cultural brokers. We invite members of the community to come in and sit at the table with us when we're making decisions about a family. Things like blind removal, to see what the impact would be of making decisions without reference to race. UCLA's issued a report, and they've given us some guidance on how to make better decisions in the future to help strip back some of the bias and some of the racism that we know we've experienced over the years.
For children in foster care, you also have beautiful, culturally authentic programs such as the Quinceañera, right? Talk to us a little bit about that and maybe other programs that cater to your diverse population.
Well, we want children to see themselves as beautiful and see their culture as beautiful. So we do have programs that help children celebrate who they are. Things like Quinceañera, so once a year we gather young Latina girls together and throw a Quinceañera party for them. Black children in care have needs around hair care. So we have programs now to teach people how to take care of textured hair, how to use products that are culturally appropriate for Black hair care.
A significant number of youth aging out of the foster care system do end up homeless, according to some statistics. So what is your department doing? What initiatives are in place to curb this?
The county is challenged to deal with the homeless and housing problem, and unfortunately, our youth enter into that challenge. So we try to get them ready as best we can. We have a guaranteed income program called Breathe, which I think is maybe the first in the nation to provide a guaranteed income to youth who are leaving our system so that they have a basic, reliable source of money to help cover their needs, like housing and food. We're trying to work with the federal government and our housing authorities to provide housing vouchers for youth who are exiting our system. But we know that still today, too many end up homeless or in unstable housing. Too many struggle to find food and to find the stability that they need. We have much more we need to do.
LA County has the largest child welfare system in the country, and you're the leader of that whole system. There's so many different initiatives, different programs. But for you, what is front and center right now?
We want to prevent child abuse. So the county has started a county-wide prevention initiative, and child welfare is one of the 3 focal areas of that prevention initiative. I sit at that table, and really I think that's what's going to change our system and change our county.
On a personal note, your grandfather grew up very poor. He put himself through school. He became a doctor, and then he opened up a clinic in the US-Mexico border, and he was able to help children in Mexico that couldn't afford health care. How did that inform your work?
My grandfather ran a camp for children that were medically fragile. He would bring them up from Mexico. They got to do canoeing, archery, and horseback riding. I grew up going to that camp over the summer. I think that planted a seed in my mind that was activated years later when I got into a position where I was able to help children that needed help.
And this is such a wonderful example of how having a positive role model in your life affects you in the long run, right?
Yeah.
And that's what you're trying to achieve with all of these foster parents or even family reunification, having positive role models so that these children can go out and do amazing things like you did.
Yeah, I think I saw the need to use your privilege, your blessings, your resources to help others.
What's your heart's desire for Los Angeles County's children and youth care in the future?
I hope they are happy. I hope they're well. I hope they're peaceful and at ease. And I hope they're filled with loving kindness.
So if someone wants to learn more about your programs or possibly become a resource parent, where can they find more information?
It's our website. It is DCFS at lacounty.gov.
Thank you so much, Brandon, for all the work that you're doing.
Well, thank you.